Now, huwag kang magmalinis. At huwag mong sabihin na malinis ang iyong ahensya. Just accept the fact na maraming problema dyan sa FDA and you'll do something na para linisin yan. Period.
Peto.
Maybe you need to, Mr. President, maybe you need to ask your corrupt people in your agency. Marami po mga corrupt yan sa mga kasamahan mo. Siguro isa-isa silang tanongin niyo po. Kasi nga po, really, it doesn't make sense. I'm telling you. Pag nag-request, Mr. President, ng extension, dinideny. Bakit? Dahil humihingi ng kotong.
Your Honor, Senate President, regarding po sa pag-pull out ng mga expired na CPR, as my feed po, we don't do that.
Yes, you do. Mr. President, yes, you do. Yes, you do.
With regards to the normal process, Your Honor, yun lang po.
I have with me some complainants na nagreklamo na nalugi ng 10 million, may nalugi ng 50 million pesos. Yan sa pagiging kawatan ninyo dyan sa FDA. Kanina sinabi mo, you will not tolerate at walang problema sa ahensya mo sa FDA, so parang malinis ang FDA. Now, let me tell you this. Because of a complaint, I spoke to a previous Director General and she admitted to me na draft ridden ang inyong agency. And she admitted to me, oo nga, 5 million to 20 million ang hinihingi kada produkto. That's why she said she's gonna put a stop to it. Pero, hindi niya napigil, hindi niya naputol yung practice na yon. That's why, natanggal siya. Now, huwag kang magmalinis. At huwag mong sabihin na malinis ang iyong ahensya. Just accept the fact na maraming problema dyan sa FDA and you'll do something na para linisin yan. Period.
Your Honor, I have to be honest. May mga naririnig po talaga ako. But the problem is, I do not have leads. Ngayon po, I'm telling you, because hindi ko po talaga hayaan yung ganyan. So I want to coordinate also with people that have a knowledge regarding sa corruption ng ahensya ko. Puro siya po naririnig ko, but I do not have...
Mr. President, may I ask this gentleman, meron ho ba kayong bitbit na tao ninyo from PSG? O mga sarili nyong kamag-anak, kaibigan? Meron kayong sariling tao na bitbit nyo?
Meron naman po.
Ilan po yung bitbit yung sarili nyong tao, Mr. President?
Meron po kung yung regarding po sa tao ko po dinala ko po sa FDA.
Yeah, from the outside, bringing those people inside to help you with your operations or whatever it is that you're planning to do with FDA. Who are those people and what are their credentials?
Kamag-anak po, Your Honor.
Kamag-anak?
Wala po akong kamag-anak sa
Walang
FDA.
kamag-anak. So who are those people na binitbit niyo po para to help you sa pagtrabaho niyo dyan sa FDA?
Of course, sir, yung usual staffing ko po talaga.
Ilan po sila?
1, 2, 3. I think 4 or 5.
4. Okay, and what are the qualifications of these people?
Of course, sir. My chief of staff po is a lawyer.
Okay.
My PIO is also lawyer.
Okay.
I have an engineer po, a chemical engineer.
All right.
Because I need her expertise. So another one is most of the people, but one doctor also.
Good.
The doctor came from the DOH.
Okay.
He is a medical specialist too.
Noted.
And another one is a lawyer also, sir.
Okay, so you have doctors, lawyers, COS, etc. Good.
Some of them, may mga secretary din po ko, Your
Okay,
Honor.
good. Now, I'll cite you a situation na very upsetting at magagalit po siguro ang mga karinig nito. If a company is seeking for a renewal of his product, certificate of product renewal, at inabutan po na expiration ng renewal, yung product niya from previous years na kung saan na-approve na po. And so, I'll cite you an example. Halimbawa po, due to expire yung certificate of product registration o CPR, January 2023. January 1, 2023. Pagtungtong po ng January 21, 2023, lahat po ng product na nasa shelves that was manufactured prior to January 2023, January 1, 2023, at hindi pa expired, bakit po kinakailangan i-pull out at kinakailangan itapon na lang yon bilang lugi na lang ng manufacturer? Now, before you answer that, Mr. President, binibigyan po ng dalawang options. Yung pong company naghihingi ng renewal. One, bibigyan siya ng provisional extension. 2, sumulat siya sa FDA para sa extension na yon. 9.5 out of 10, siya po ay nare-reject yung kanya pong request. So what happens next? Yung pong mga produkto na nasa shelves, kailangan i-pull out para sirain na lang, itapon na lang. Pero may paraan para hindi mangyari yun. Kailangan magbigay. Depende po sa number of products na nasa shelves, ibibilang po yan, and then magbilangan at magkakaroon po ng aregluhan in the amounts of maybe hundreds of thousands or even millions. Don't tell me hindi nangyari yan.
Your Honor, Senator,
Because for me, Mr. President, it doesn't make sense. Yung pong produkto na wala namang kinalaman sa paghingi ng renewal for registration nitong isang company, bakit po madadamay? Bakit po kinakailangan i-pull out sa shelves? Bakit hindi na po natin payagan na hanggang maubos yun?
Senate President, Your Honor, I do not have any rules which is under my mind.
Under your mind, Mr. President.
Wala pa po on my knowledge regarding that. So maybe I can ask my field regulatory operations kung yan po ongoing or may ganyan mga aspeto.
Maybe you need to, Mr. President, maybe you need to ask your corrupt people in your agency. Marami po mga corrupt yan sa mga kasamahan mo. Siguro isa-isa silang tanongin niyo po. Kasi nga po really it doesn't make sense. I'm telling you. We are talking of hundreds of thousands and even millions na lugi po ng isang kumpanya na kailangan i-pull out sa shelves, sa mga tindahan, sa mga butika, just because nag-a-apply siya ng renewal at naabutan po na expiration yung renewal niya. Even if this was manufactured before the time that it was expired, before the time that he is manufacturing a new product to be asked to be renewed. So kailangan i-pull out sa shelves. At kapag nag-request, Mr. President, ng extension, dini-deny. Bakit? Dahil humihingi ng kotong.
Your Honor, Senate President, regarding po sa pag-pull out ng mga expired na CPR, as my feed po, we don't do that.
Yes, you do. Mr. President, yes, you do. Yes, you do.
With regards to the normal process, Your Honor, yun lang po.
I have with me some complainants na nagreklamo na nalugi ng 10 million, may nalugi ng 50 million pesos. Yan sa pagiging kawatan ninyo dyan sa FDA. 50 million, meron pa nga isang kumpanya, napakaliit niya, she has to shut down.
Your Honor, regarding po dyan, yun nga po, wala kaming proseso na ganun. If ever po yan, talagang ganyan ang ginagawa, open po opisina ko 24/7, sir. Sabihin niyo po sa akin, complain niyo sa akin.
I'll take your word for that,
Yes, sir.
Mr. President. Now, toxicity report. Hindi niyo po alam yun?
Sir, what specific, Your Honor? Toxicity report.
Alam niyo po yun?
Yes, sir.
Okay. Para mabigyan ng go signal ang isang produkto na nag-request ng Certificate of Product Registration, CPR, kailangan magsabit din po ng toxicity report. At dito po, it takes at least 1 year and sometimes 2 years bago lumabas po yung report. Now, you have 3 years para sa renewal and then 1 to 2 years para sa toxicity report. So we're talking about 5 years. Doon pa lang sa 5 years na pag-aantay, wala na po, nababankrupt na po ito maliliit na kumpanya. At bakit? Sapagkat may mga malalaking kumpanya na pinapaboran po ng FDA na talagang gustong-gusto mapatay ito maliliit na kumpanya. Dahil ito maliliit na kumpanya, maliit sila, mura yung kanilang produkto, they're trying to compete with the big guys, and the only way to compete is to offer cheap, quality-priced medicine. So ngayon, nakikita ng malalaking kumpanya na malulugi sila, so they have to kill this small guy. And how are they gonna do that? FDA. Corrupt people in the FDA.
Your Honor, I'm asking my director if the toxicity level is a prerequisite for drugs. So, maybe later po pa sagot ko po. Regarding po dun sa mga pagpatay sa mga maliliit na negosyo, being appointed by the President, this is the prerogative or the goal po ng Presidente na itingin ang ekonomiya natin. So, ang number one policy po niya is to have a fair play with all the stakeholder. Yan po ay talagang ginagawa natin simula na naupo na tayo. Kung yan po ay talagang ganyan, tawag po nga natin dyan, yung honor, ipitan So, kung yan po ipitan talaga, makikita ko naman yan. Kaya nga po ginagawa ko yung ICT para makita ko kung saan tumatagal yung produkto. Kung saan tumatagal yung registration. Sinabi ko sa ICT yan. Sabi ko sa kanila, gusto kong makita kung saan tumatagal. Then I call the attention of that person to prevent red tape. Yun po naman talaga ang natin, ang agenda natin. But as for now, I must admit po, Your Honor, Senate President, medyo hilaw pa po yung aking sistema dahil nakalistnan ko po siya na halos 30% automated pa lang po yung aking ahensya. So bigyan nyo lang po ako ng oras. Then for now, I'm open with all the complaints, sir. Actually, I always want transparency in my agency. So, for the meantime, sir, yun po magagawa ko, but I promise, rest assured, that I can monitor that.
I'll tell you the reason bakit nagkakaroon po ng delay sa toxicity report. Dahil it's out of your control. Ito po ay isang independent laboratory. Example, UP, SGS. Overwhelmed po yung mga laboratorio na yon, kaya inaabot po na 1 taon. That's beyond your control. My question is, ano ang pwede mong gawin para ma-address ang problemang ito?
Sir, number one, independent laboratory po as per my director, the test of toxicity, because we don't have capacity for that, diba? We don't have capacity for toxicity po. So, independent laboratory which are, yung po yung nagtetest, I can streamline do kasi may mga organization naman po sila. Tingnan natin kung talaga po sila may ganyang nagpapahamak sa mga maliliit na negosyo. For the meantime po, yun po kasi wala po kaming capacity for toxicity.
I know.
So, ang mangyayari po, they test it outside, then we wait for it. Now, out of hand na po namin yun kung paano nila ginagawa sa labas. But what I can do is the accreditation. Kung pagka yan po may complaint sa kanila, pwede po nang tanggalin natin accreditation yan sa amin.
Mr. President, siguro po may suggest ko sa iyo, what's your name? Dr. Samuel Sakate. Siguro po, kayo po mag-invite ng mga private laboratories na pwede nyo ma-accredit, na pwedeng magamit, maparami, nang sa gayo mabawasan po yung backlog ng ibang mga laboratories, existing laboratories ngayon, na hindi niya po makaya yung volume ng request from different drug manufacturing companies.
Your Honor, there is an organization of laboratories. I can call their attention po.
Call them.
Yes, sir. Yes.
You know why? Bakit hindi po ginagawa ng paraan? Hindi ginagawa to? The more delays, the more money they can ask from the manufacturer. As simple as that. Dahil, nag-iingalaw na po yung manufacturer. 1 taon na po nag-aantay. Hindi pa rin po lumalabas yung toxicity report. At sasabihin po ng FDA, it's out of our control. Hindi amin yan. Problema yan ng lab. Nakita nyo naman, UP yan, SGS yan. So ngayon, itong pobre, nag-iusap sa inyo. So each delay that happens doon sa proseso, it means pera. Yun na po eh. The more delay, the more money can be asked from the manufacturer. Graft-free din po ang FDA. I receive tons and tons of complaints, hundreds of complaints from manufacturers, from small-time companies that manufactures skincare products, energy drinks, etc. Ang lakas nila pong tumaga. Sobrang lakas nila pong tumaga.
Sir Honor,
Hindi po kayo. Hindi po kayo.
Thank you po.
Kundi yung mga kasama nyo dyan po sa FDA. Now, bago ako pumunta sa Senate, nung ako po'y broadcaster pa lamang sa Wanted sa radyo, I promised myself, nung nangampanya pa lamang, isa po kayo sa babantayan ko. Rest assured. Hindi ko po itatantanan hanggat di po matigil at masibak ang mga tiwali niyong kasamahan dyan. Because alam mo naman po, maraming tiwali dyan sa inyo. And again, I would repeat it, nakausap ko po yung dati yung district director at inamin niya po na meron talagang bigayan. At sabi niya she will stop, hindi niya po napastop hanggang siya po ang natanggal. At kapag hindi niyo po napatigil yan, maybe, baka kayo po'y matatanggal. Kasi po, ako'y magbabantay sa inyo. I'll be the monkey in your back. I can assure you that. Do your job well, then I'll back you up. I'll make sure na maging maayos ang trabaho mo at pupurihin ko pa kayo.